The Silver State Health Insurance Exchange exists to connect Nevadans who are uninsured by their employer, Medicaid or Medicare, to health insurance options. And the man who heads this insurance exchange, Ryan High, joins us this week for Nevada Week in Person.
Support for Nevada Week in Person is provided by Senator William H. Hernstat and additional supporting sponsors.
Welcome to Nevada Week in Person. I'm Amber Renee Dixon. Described as having a zeal for decreasing Nevada's uninsured population, Ryan High served 6 years as Chief Operations Officer for the Silver State Health Insurance Exchange before becoming Executive Director this year. Ryan High, thank you for joining us.
Thank you, Amber.
That zeal for helping to get uninsured Nevadans insured, where does that come from?
Sure. It's a personal story for me. I remember when I was 6 years old, my mom and dad had a conversation with me and my brother saying that my mom was feeling tingling in her legs and explaining to us that she went to the doctor and was diagnosed with multiple sclerosis, or MS. So I grew up with this disease my entire life until she passed away when I was 17. So that really created a passion in me and showed me the importance of health insurance and how it affects families. In addition to that, my formal education, I went to an undergraduate school in Baltimore, Maryland, Loyola College, a Jesuit institution that promoted community service. And then for law school, I went to a public interest law school, the University of the District of Columbia. So it was a chance for me to, in this particular job, to marry public interest and community service with my own personal story.
Wow, having a good heart and mixing that with law, that's pretty neat. As far as your mom's situation, did she have insurance as she was battling this?
She did. And my dad worked a lot to make sure that we could pay the bills and that we kept our health insurance. And as I got older, especially driving age, it was me taking my mom to her doctor's appointments or to the hospital. So I literally lived that disease. But I also, it formed in me an appreciation of how important health insurance is, not only for your well-being and care, but also your financial situation.
Explain more to me about that, your financial situation.
Sure. So I remember, going to the mailbox and getting the mail and seeing bills from doctors or from hospitals and wondering, I knew how expensive this disease was to our family. But the fact that we had that health insurance, it really helped put our family in a position where we didn't have to worry about things like medical bankruptcy.
Wow. At what point did you learn that that is not the reality for everybody, that health insurance is not something everybody has?
It was really highlighted in this job, in this position at the exchange, and learning that about 20% of Nevadans have some type of medical debt on their credit report. I just can't emphasize enough how important, again, not only to your personal well-being, but to the well-being of your pocketbook.
So the Silver State Health Insurance Exchange, also known as Nevada
Health Link.
Okay. It is for a specific population who is not insured by their employer, Medicaid or Medicare. How many Nevadans actually fit into this category?
So we had, last year, our enrollment numbers were over 101,000 consumers that actively shopped and bought plans on the exchange. It was a record-breaking year for us. We were up about 24% over the previous year. It was just a tremendously successful year. In addition to that, there's probably close to between 100 and maybe 120,000 Nevadans that are eligible for exchange coverage that aren't taking advantage of it.
What do you think is keeping them from taking advantage?
I think education is one, and understanding the affordability that our plans can offer. About a half of our current consumers are paying $100 or less in monthly premiums, which is relatively affordable shopping on the exchange, and 9 out of 10 of our consumers are receiving a federal subsidy or an advanced premium tax credit on their monthly premium bills, which means that instead of reconciling taxes at the end of the year, these consumers are getting that immediate tax incentive every month, so they're paying lower monthly premiums.
And I know the American Rescue Plan helped in some of those subsidies. I'm going to get to that, but I wanted to go back to the success that you're coming off of with enrollment. You said 24% increase?
Increase. We went from 81,900 last plan year up to over 101,000 this plan year.
What do you contribute that success to?
I think a lot of this is due to those American Rescue Plan Act benefits or enhancements. So last March of 2021, the current administration passed the American Rescue Plan Act, or ARPA, as we call it. And what that did was it gave consumers that had at least a week of unemployment insurance, $0 health plans shopping on the exchange. It increased subsidies across the board for all of our consumers. And it also removed what's called the 400% FPL cliff, or federal poverty level. Before ARPA, consumers that were making over 400% of the FPL received no subsidies. ARPA now allows those consumers over 400% to receive subsidies.
Could you put that number into something maybe more understandable? 400%, what would that be? You're talking about?
Sure, say a single individual may be making around $40,000 or $50,000 a year.
Okay.
So before ARPA, if you were making that much, you would not receive subsidies. But now if you make however much over that, you will receive subsidies now because of ARPA.
And I think people might be hesitant about signing up for health insurance like this because knowing that those subsidies might not actually continue. You might not have this rate for maybe more than a year. And that is the case with the ARPA funds. They could be expiring, at least these subsidies that we were talking about. What is the status with that and for people that are benefiting from these?
Sure. I'd like to highlight, first of all, the benefits so we can talk about really how important this is. So two concrete examples are, one is a family of 4 in Las Vegas. We noticed that they went from a $348 a month premium each month down to $0 because of ARPA subsidies. A 29-year-old single male in Las Vegas went from $320 down to $39 a month because of these extended ARPA subsidies. They are just so important. And the current status is our federal delegations are trying to work this out between the House and the Senate to get this passed before it expires at the end of this year in December.
So those people you're talking about could go back to those rates?
Those higher rates, that's correct.
What do you know about when Congress might take this up again?
That is a great question. I was just in DC meeting with some other state-based exchange directors. We were hoping that something might be done by the July 4th recess. We're just waiting. We're just waiting at this point.
Why do you think healthcare is so highly politicized when it's just a basic need?
You know, no matter what party you are, I don't think that it should factor into politics that way. Cancer or diabetes or a heart attack doesn't care what party you are. But having that health insurance, that's the important part, to make sure that you're taken care of if you do unfortunately come upon one of these diseases.
So you have been through several years where there have been attempts to repeal the Affordable Care Act. If that were to happen, what would the impact be on Nevada HealthLink?
Sure. Well, at this point, there are no immediate threats today, I would say.
Right.
But it seems like regarding the Affordable Care Act, we're always playing defense, and it's always being attacked. But the impact it would have is, you know, pre-existing conditions. That's a huge benefit right now from the ACA. That would probably go away. Those monthly subsidies, just the financial impact of having the ACA go away, and those APTC credits, those tax credits, that would be huge too. And then losing, right now carriers have to provide the 10 essential health benefits. These are things like ambulatory services or emergency services or hospitalization, maternity and pregnancy and newborn care, mental health and substance abuse disorder care and services. Those would go away too, or they might not be required if the ACA went away.
Okay, so then Nevada HealthLink is not independent of what happens at the federal level, is what you're saying?
Right.
Okay. So then when we talk about within the Nevada legislature, there was a bill signed into law for a public health option in the state of Nevada that should be available by 2026. Yet it has to go through the legislature again in 2023 with some revisions possibly once there have been some studies on how feasible it is. How does that differ from what you're already offering? It's not universal health care, right?
Right, it's not. No, these plans would be sold on our exchange, on Nevada HealthLink, and the first year would be a 5% decrease in prices over current exchange plans, and then over a course of, I believe, 4 years, a 15% reduction in plans. These plans would also, consumers would be able to take advantage of the subsidies that are offered through the ACA. So those are the big benefits, the price reduction, although you're keeping those 10 essential health benefits.
That is something to look forward to.
Sure.
And what role are you playing in the development of that process?
Sure, so we will be on the technology side. These public health option plans will be sold on our exchange, on the platform at Nevada HealthLink.
How user-friendly would you say Nevada HealthLink is?
I personally think it's really user-friendly. When you go onto our website, we have a lot of options to help consumers. One is we have an anonymous shopping tool where you can go on before even filling out an application to see what kind of subsidies you might receive or what plans that you might be interested in. We have a Find a Free Local Assistance tool where we connect you to over a network of over 600 brokers that we have certified with us in the state, and/or navigators. We have navigator entities such as St. Rose Dignity Health here in Las Vegas is one of our navigators.
Why anonymous?
Sometimes consumers want to go in without putting in their personal information, right? Mm-hmm. And the anonymous shopping tool, it's a quick, maybe 6 or 7 page application where you can go in there and put in your information, put in your zip code, put in what your annual salary is, and just like that, find out what plans maybe possibly fit in your budget.
Before we move on to a little bit more fun, I wanted to ask about the people that may be at risk of losing those subsidies if they are not extended by Congress. What do you want them to know? Should they be doing anything?
Well, I want them to know that you can shop for other plans. On the exchange, we have different tiers. We have gold level tiers, silver level tiers, and bronze level tiers. If for some reason these subsidies go away, please come back on and shop to find maybe another plan that's affordable for you. Maybe it's just in a different tier, but you'll still have that coverage for those, and you'll still receive those 10 essential health benefits.
Oh, I do have one more serious question. You worked with the Secretary of State's office here in Nevada. That was your first job when you came here. How difficult was it going through an election in which there were claims of election fraud?
I have full faith and credit in our election system here in Nevada, working at the Secretary of State's office for 6 years. I was the former Help America Vote Act administrator for the office, which meant that I worked closely with the statewide voter registration list and our statewide voting systems. And I think having that knowledge and the knowledge of the audit system afterwards, we have a great system here in Nevada.
All right, to lighten it up, you are an outdoors enthusiast. You're from Maryland. What was life like when you were having adventures up there, and how have you adapted to Nevada? And you are up north most of the time.
I am. I live in Reno. I work in Carson City. I feel like I basically traded the shores of the Chesapeake Bay for the shores of Lake Tahoe up there. But the whole state of Nevada, I love the mountains. Maryland's a pretty flat state. But here, whether it's in Las Vegas here or up in Tahoe and Reno, I love the mountain and the mountain lifestyle.
So is that hiking or is that mountain biking?
It's everything. It's hiking, it's snowboarding, it's stand-up paddleboarding or kayaking.
Any plans coming up for some outdoor adventure?
I do have plans to go back to Maryland actually this weekend and visit family. So I'll go back and spend some time in the water and hopefully eat some crabs.
Ryan High, thank you so much for joining us for Nevada Week in Person. To see this interview and many more that we have done for Nevada Week in Person, go to vegaspbs.org/Nevada Week.